Sure, Jim, I'd be happy to. I'm going to talk about probably one of the largest business problems that I've ever had to face, and that is basically creating an entirely new agency and an entirely new IT organization within that agency. In the DoD, the money that we spend for healthcare has been rising rapidly over the last couple of years. We're currently running a budget of about $53 billion, which is about 10% of the DoD's total budget. Seeing this rise in healthcare costs, the Congress a number of years ago in an NDAA mandated that we take a look at our healthcare spending and our healthcare organizations as they currently existed across the services and do two things. Basically, take a look at how we could more effectively manage the system if we were able to bring the medical services of the various services, capital S, together. And deliver a more effective healthcare. And then the second thing, to take a look at a number of our back office functions that would be possible candidates to be put into a shared services model. And so the leadership across the services, along with the health plan, TRICARE, formed a group, and we looked at various things that we could do, various methods of standing up the agency, and looked at various functions that could be put into a shared services agency. We came up with 5 to start on originally, and they were pharmacy and logistics and health plan ops and facilities and finally IT. And so as a leader in the IT organization, I was asked to basically architect the consolidation of the IT capabilities within the medical communities of the various services and develop, design, and bring into being an operational IT entity that basically went live coincident with the stand-up of the overall agency last October 1.
Essentially starting from a clean slate.
Clean slate, totally blank piece of paper.
Man, I would think that's really neat to have that opportunity.
We had good days and bad days, let me tell you that.
Well, let's hear about some of the benefits that came out of it.
Well, there were a number of benefits. Congress anticipated realizing some benefits, and as part of our mandate from Congress, we had to do a business case, a real business case, by the way, like they do in the commercial sector with investments and savings and return on investment and all that stuff. So we put an organization together, we developed a business case, and I'll highlight some of the major benefits.
Okay.
One was cost. We realized that as we looked across the services, there was lots of duplication of infrastructure, lots of duplication of application functionality, help desks, all kinds of things. And so we figured cost savings was going to be significant, and our business case basically had 3 components of savings. One was around consolidation of management and consolidation of our contracts. The second area was around the consolidation of the infrastructure. You know, we had almost 3 and sometimes 4 of everything: desktop, or data centers, and help desks, and networks, and all that stuff. So trying to put all that together. And then the third area was application rationalization. How can we eliminate the duplication in our application portfolio? And so so we embarked on efforts around modeling that and put together a business case, and I'll be able to talk about how we've done in the first year here, probably later on. Second thing, we needed a more reliable network. We needed to consolidate our networks. We need to have less variability. We need to have better uptime in terms of service to our customers, our hospitals across the system. And we thought we could do this through an effort around standardization, consolidation, and centralized management. Not only to be more reliable, but to take some costs and some personnel out of the equation. Consolidation of IT activities. We anticipated not only one network, but what we found was that across the 3 services, if we had a given application that has to run on all of the hospitals, it has to be certified by each service individually. So that's 4 or at least 3 ATOs with all the attendant costs and things like that. So we could consolidate those activities, put everybody on a single network, and now I can buy an application, put it anywhere on the network, and then it's certified and good to go anywhere. Another thing that we took on was alignment with the overall DoD direction in terms of information technology. We're working with them on the Joint Information Enterprise direction that overall DoD is taking. And as a matter of fact, given our timetable, we're actually going to be sort of one of the leading entities of
Right.
the DoD that will actually ride information on that network.
Now, if I asked you to wrap up here and give us, what are some like key lessons learned or maybe keys to success that you think you learned through the process?
Well, key lessons learned. I mean, I talked to a group of our senior military leaders at a conference last week, and I told them this is not about an exercise in technology. This is an exercise in anthropology. This is
I like that.
yeah. This is an exercise in change management. What do they say? Culture will trump strategy any day, and so
Absolutely.
we've got lots of cultures to deal with, lots of change management. So, a couple key lessons learned is get people on board on the team who are excited about doing this work, convinced that it'll be successful, and are anxious to help make a change and move forward. Second lesson learned would be that absolutely you need support from senior leadership. This is a difficult transition. People find that organizations are disrupted, funds flow disrupted, technology gets disrupted, and oftentimes you're called upon to ask senior leaders to make some pretty tough decisions. And third, and it bears repeating, is that communication is critical. Communicate, communicate, communicate. Up, down, across the organization, you can't do enough. So you need to use multiple modes. You know, we have websites, we have emails, we have town halls, we have various report outs to our leadership.
Terrific.
Things like that. So.
Terrific. Thanks.